Okay, so I am really happy to see you. And first of all, this is our informal group, so you should feel free to interrupt. Though, since if I'm screen sharing, I may not see you, so um, sort of shout out or call my attention or whatever. So the plan here is that we're going to have three separate sessions. The first one is kind of um, the U.S. the American medical research and public health history, establishment, and what has been done to it. So that's kind of the bad news. Then we're going to talk about some good news on the front of things coming out of immunology. So I'll have to tell you some immunology. And that'll be a little like a science class at first. And then we're going to talk about cognitive aging, which this salon demonstrates we are not aging terribly, at least. We're hanging in there. So I don't know how many of you happened to look at The Guardian this morning as before I screen share. The headline on one of the articles online is US is, quote, simply choosing not to stop, close quote, the Ebola outbreak after massive public health cuts, experts say. So that's this morning's bad news. And we're going to come back to this in a while. Okay, but let me start by screen sharing. And let's first make sure everything is going to go smoothly. Where are you? PowerPoint, share. So you should be able to see this now.
Hmm.
Yep.
Yep.
Okay, good. So this is kind of the outline, the history, and it's bad news. Trump and RFK Jr. have been trashing things. Good news, the immune system is fighting back, and we are actually making progress in Alzheimer's. So medical research and public health infrastructure in the US is mostly under Health and Human Services, which is currently headed by brainworm Robert Kennedy Jr. There are 13 divisions, and several of these will pop up now and then, but three are key. So we're going to see Medicare and Medicaid a little bit, Indian Health Service, substance abuse, mental health services, children and families. But the three that are most important for this conversation, and I've worked with all three, are the National Institutes of Health, the Centers for Disease Control and Prevention, the CDC, and the Food and Drug Administration, the FDA. So we're going to start with NIH, which began in 1887 as the hygienic laboratory for the study of bacteria, and it was part of the Marine Hospital Service. I guess they were worried about Marines or something. And then it turned into the
Ah,
Public Health Service. And then in 1933, it got called the National Institute of Health, but they kept adding pieces to it. And in National Cancer Institute, for example, I think was the first edition. There was an institute in the night about 1937. And in 1948, it got renamed. And it started just with internal research, so just people at NIH itself in the DC area. And it's still the largest clinical research center in the country. And it trains physicians and does research. So you can get treated there, get into experimental studies. But beginning in 1945, they added extramural research. So that means they started funding a network of academic medical centers and scientists. And that's actually over 80% of its budget now. And that goes through grants and contracts. And sometimes individual institutes might solicit projects or centers. So, for example, the National Cancer Institute has comprehensive cancer centers, and Davis is one of those. And I was actually recruited here to help them get funded. And every 5 years, they have to be renewed and reviewed. But they also have things where you can submit ideas that are proposed by researchers. All of these get reviewed by a study section, which is a bunch of experts, typically, 30 or 40, in fact, who might review 100 proposals if it's a large group, but might just review a few centers, and then it might be a smaller group. And they, if I do this, I might get 10 different proposals to review, and I write a review that looks at the validity of the science background that supports this, the scientific merit of the proposal. Is it well laid out, and have they considered all the science stuff, and what would the impact be if it actually got funded? And then you get together and you assign scores, and NIH decides which of the top scoring ones to fund. So that's an important process, and it's supposed to be unbiased. And NIH is supposed to consider only scientific merit in funding, and something with priorities in general. The other thing that NIH does is train the next generation, and we happen to have several products of that on this call. Pomona got a grant in 1963 to have an undergraduate program to get undergraduates interested in medical research and prepare them to go out and become serious level people. And several of us in the summer of 1964 were the second NIH class. So I'm 16 years old, right? I show up at Pomona College 2 days after graduating from high school. And we had 8 weeks of paid in summer training, learning a lot of different areas of science. And we had a biostatistics and probability class. Now, I thought I wanted to be a biochemist. Lord knows why, because I didn't really like labs and I was terrible in them. But I knew I wanted to do medical research. But we had this cool biostatistics class. And Don Bentley, who taught it, was very good. I kind of goofed off the first 2 weeks, but then I was so embarrassed by the first test that I did really well after that. And Don said, oh, you should switch to math, do statistics, stay in the NIH program, but you should do biostatistics. You should go to Stanford for your doctorate because it has the best program. An unusually compliant child at that point, I actually did what he said. I did reasonably well at Pomona. I went to Stanford and was on an NIH fellowship at Stanford. So I've been an NIH baby since I was 16. I went on and have done medical research ever since I had graduated with my doctorate from Stanford. That's what I've been doing for 62 years, I guess. So NIH has really contributed to the next generation. They're still doing that. So that said, they've had a lot of accomplishments. I don't want to just have bad news here. And these are just a few of the zillions of things they've done. So the National Cancer Institute in 1950, childhood survival from cancer, that's like 5-year or 10-year survival, was 10%. Most children who got cancer died. It is now over 85%, and I have worked with pediatric cancer researchers here. Dan works a lot with several, and they're still working on trying to find new things and use new technologies, some of which we'll talk about the next talk. Breast cancer. Meredith knows about this. Breast cancer screening and treatment. There's a 44% drop in the death rate in the last 25, 30 years. There's a 5-year survival over 92% now because of early screening and advances in the screening and advances in treatment. And right now, the cutting edge treatment in some forms of cancer is immunotherapy, CAR T. Some of you may have heard of that. And we're going to talk next time about this when we know enough immunology to understand what it is. NIAID, the National Institute of Allergy and Infectious Disease, was key in identifying the HIV virus and coming up with effective prevention and treatment. I was at Harvard for 5 years, and a good chunk of that time I was involved. Harvard had the national contract for running and analyzing AIDS clinical trials with a network of some, the Tony Fauci had put together this network of 50 or 60 academic centers that could do the virology and immunology and enroll people in treatment, and worked eventually with ACT UP, with the people, the AIDS activists, and really pushed to try to get this done. And now AIDS is essentially both preventable and treatable. Now, they also, and NIAID, laid the groundwork for the basic science that led to mRNA vaccines. So probably everybody on this call has had mRNA vaccines against COVID at some point, either the Pfizer or the Moderna vaccines. And we'll talk a little bit about that when we talk about immunology. The National Institute on Aging is probably the one I've worked with the most the last 30 or 40 years, because they do biology of Alzheimer's disease and the fluid imaging and fluid biomarkers. And the first disease-targeted treatments that
Go
actually
out
work.
if you want me to, Carol.
You have questions here?
Or you can leave them with me. Oh, I'm sorry.
Oh, okay. And then the Human Genome Project. That is like Tony and I were talking this morning about the understanding of the human family extended to other branches like Denisovans and the Neanderthal and the Floriensis and all of these wouldn't have been possible without the Human Genome Project. So we can actually compare that. And that was completed in 2003, actually several years earlier than planned. So NIH has been amazing. And part of that is that, Congress has been really pretty good about funding it. From 1998 to 2003, the funding grew very rapidly. Part of that, again, was the molecular biology and precision medicine and stuff like the Human Genome Project. But in inflated adjusted dollars, it's been pretty flat since then, little increases. Okay, we're going to move on and talk about the CDC. We're going to come back and see in a few minutes what's happened to NIH since all this. But I wanted to tell a little about the other two big entities. So this started in July 1st, 1946. Was anybody here born on July 1st or around at that time, 1946? You sure? We're roughly
July 4.
Hmm? All
July
right.
4th. Yeah.
So we are contemporaneous roughly with the Communicable Disease Center or CDC, and they started because of trying to prevent the spread of malaria. They expanded then to have a vast portfolio of responsibilities, all communicable diseases. They do disease surveillance, they do testing, they added occupational health, so things like lead exposure at work, chronic diseases in the population. So they do these big national surveys that track heart disease risk factors and height and weight and all kind of stuff. National strategic stockpiles. They're the guys who are responsible for all those masks that were or were not there in the COVID epidemic, and a whole bunch more. They also, because we have this very fragmented public health system, they provide support and advice to state public health departments, county departments, local public health departments, like New York City has its own, and healthcare providers. So they're pretty cool. And they have had amazing accomplishments too. They started working on malaria and it became no longer a major problem. It was very endemic in the south of the US. And owing to their work on smallpox, the last smallpox case in the US was in the 1940s. In the 1950s, their polio surveillance program supported the big Salk vaccine trials. I was a polio pioneer. I got the actual Salk vaccine as opposed to the placebo when I was 7 years old. And then, of course, we went on to have the Sabin sugar cube guy that probably most of us have had as well. The Hong Kong flu pandemic, 1957. Did anybody get sick in 1957, really sick? In San Jose, in Santa Clara Valley, they had this Camp Campbell up in the Santa Cruz Mountains, and sixth graders would go up there for a week and study nature. And it was a very beautiful place. It was on the San Lorenzo River. And it was just way cool. Unfortunately, the week that I went in 1957, fall, was the week that the Hong Kong flu pandemic started hitting its peak. So you take a bunch of sixth graders from all over the county, plunk them down in a overnight camp setting, and poof, everybody gets sick. And then takes it back and gives it to everybody else. So I got really, really, really sick. And I still remember it because my dad had to come up and pick me up. I made it till Friday and drive me back. And I was as sick as I've ever been in my life, and fever 104, very, very sick. But this motivated people to think about what do you do in pandemics. More on this will be coming up. They did the first National Health and Epidemiology Survey. They took over the morbidity and mortality weekly report. That's the one that says, how many cases of COVID per week, how many people died, and splits it down now by age and sex and all kinds of stuff. They had a measles eradication campaign and rubella immunization. In the 1970s, they looked at lead exposure and figured out that being near lead smelters was causing brain damage and damage in kids. They figured out that even the lead in gasoline from car exhausts was causing problems. That's why we now have unleaded gas. They also had an outbreak of Legionnaire's disease, called that because it hit a Legionnaire's American Legion conference in Philadelphia. And they figured out that it was spread through the ventilating system and tracked that down. 1980s get kind of interesting. The CDC, in its MMWR, its monthly report, had reported 5 cases of pneumocystis pneumonia in young men in the Los Angeles area mostly. And this is weird because this was previously something that was only like really old, sick people. And people started, the CDC thought, well, we better investigate this. And they enlisted their compatriots and eventually they were the ones who uncovered, they with NIH uncovered the AIDS virus and epidemic. So the initial reporting came from this CDC tracking. In the 1990s, their reports came up with data on the fetal alcohol syndrome. They were also tracking the West Nile virus. And we just had our first case of mosquito with West Nile, and the mosquitoes, the Aedes aegypti that carry it, are now around where I live in Davis. And then we just had several mosquitoes trapped by local public health departments and found to have West Nile. So you don't want to go out and get bitten by the mosquitoes. The year 2000, measles were declared eradicated in the US. That means there's no within the US transmission at that point. The 2010s, the CDC was key in dealing with an Ebola outbreak in Guinea, Liberia, and Sierra Leone. And of course, we all know 2020s, they played a key role dealing with the COVID-19 pandemic. Okay, we're going to get a little history on the FDA, and then we're going to find out what's happening to all these guys. So this is the oldest of the 3 groups. It began in 1848. Did you know the FDA was started in 1848? I did not know that. And it began with the Department of Agriculture. They had a chemistry bureau testing ag products because people were doing things like putting chalk into white flour to make it look whiter. And all kinds of grody things. So they actually started testing products. But there were a lot of loopholes. And in 1906, under Teddy Roosevelt, encouraging this, the Pure Food and Drugs Act, this was before Republicans became so violently opposed to regulations, to oversee things that were traded through interstate commerce. And this was, again, under the Department of Agriculture, the Bureau of Chemistry. And it got renamed the FDA, Food and Drug Administration, in 1930. But there's still a lot of loopholes, and there were some really bad examples like mascara that made people blind. And there was sufficient outrage over all of this that the second Roosevelt president, under his administration, they actually had the Food, Drug, and Cosmetic Act in 1938, and they have standards, but also procedures for evaluation, which are pretty rigorous. The thalidomide case led to even stricter standards because thalidomide was a drug that wound up being approved in Europe for treatment of hyperemesis gravidarum, pregnancy nausea. But it turned out it also led to major birth defects, with babies born with arms and legs truncated and little tiny hand-like things. And in the US, though, it wasn't approved because the FDA leadership felt that they hadn't had adequate data on it and they wanted to hold it up. And so we didn't have all this happening here, except for people who went to Sweden to get thalidomide. The process, though, part of this is because the process for a new drug application is very complicated. So they, especially motivated by the AIDS epidemic, started trying to simplify it. And for example, for bioequivalence, so if you get, say, Tylenol approved, but then somebody comes along and says, well, I can make acetaminophen and it's the same thing as Tylenol. That's easier to get approved. You don't have to go through all the clinical trials because there's already an approved version of it. All you have to do is show it's equivalent, chemically. And this fast track option exists in some special cases, but there has to be a real reason for it. It has to be either for a condition that doesn't have anything else to treat, or there's a lot of really strong evidence. Here's a cool one. Did you know that living organisms can now be approved by the FDA? Maggots in wounds got approved in 2004. Leeches are approved. I think this is just way cool. Devices now include things like biomarkers and surrogate markers, so blood measurements that might tell if an Alzheimer's treatment is actually working, even without waiting 3 years to see if your cognitive function has failed to decline, has stayed steady. I've been involved in some of those approval processes as well as in the HIV clinical trials. So I've worked, I know kind of how FDA works. So, oops, sorry. Here's the bad news. Now we're going to start on bad news for a while, and I'll have to apologize. The bad news is that basically the Trump administration and Bobby Kennedy Jr. have trashed all three of these agencies and broad areas of attack, research and public health. The funding cuts to all three agencies initially started by Musk and his Doge project, but they were laid out in Project 2025 by Russell Vought, who's now the budget administrator of some sort. Personnel. They have huge reductions in staff at all three agencies, but especially experienced science leadership fired or forced out. Some of them, forced to transfer to other agencies or moved or, and I think Tony Fauci was going to retire anyway, but people of that level of responsibility and competence gone. Policies originally were supposed to be based on science and medical evidence, but they're now being based on ideology, conspiracy theory. Bobby Kennedy Jr. has some cuckoo idea, and it turns into policy. Data collection. So, statistician, I think I am concerned about data, but it's really important because that's how we track diseases, notice things like the 5 cases of pneumocystis pneumonia. And that's been reduced or eliminated. And international partnerships have been ended. We're no longer in WHO. And the results are evident. So I'm going to actually show some of the things that have happened. Trump proposed a 44% cut to NIH, eliminating half or so of the 27 institutes. We have been saved because Congress has not gone along. They actually gave NIH essentially a flat budget in the last round. But, Trump wasn't happy about that, and people who disobey him have been losing in Congress. So the next round of budgets, we'll see. In January 2025, when Trump came in, 7,800 grants were terminated or frozen, on almost 6,000 at NIH. Some of them were reinstated. Some universities sued, and that actually was successful in the courts in many cases. But a lot of this was to wipe out areas of research that were disapproved, so disproportionately grants on studying misinformation about science, vaccine studies, development of vaccines wiped out, infectious disease study out, HIV prevention out, anything where people from underrepresented ethnic or gender groups were the focus out. We were actually given 3 pages of words that we should not use in applying for grants or reporting progress on grants. And because the little doji people were using AI to search for words that they considered anathema. So we had replacement words and concepts that would not trigger the cutting or not even reviewing a grant. The key leaders that were removed in a lot of cases weren't even replaced, or if they are replaced, they're replaced with unqualified ideologues. Some people were actually told, oh, we're just going to reassign you to the Indian Health Service. So they're not fired. They're just said, oh, you could go to, Pine Ridge, South Dakota and be a doctor instead of being a medical research doctor at NIH in Bethesda. CDC doesn't have a permanent director yet, nor does the FDA. They put in a couple of people who were unqualified and quit, or were qualified and got fired in some cases. There are huge budget cuts to Medicaid, and that affects both patients and hospitals. Grants to develop vaccines have been cut. So here's a graph that just shows the personnel cuts. NIH, CDC, and FDA all had cuts of approximately 25%. This is from Nature. A lot of people at early career stages, but also the key leaders. This has an impact. Data that were removed from the web or are not being collected. The databases on vaccines, gender and racial disparities, hate crimes, and more were just removed from the CDC website. Tracking programs have been eliminated or are no longer being collected, or the data exists but are made inaccessible on maternal health, sexual orientation and gender identity, reproductive and contraceptive data, and some of the infectious disease data. Here's a cool thing that people are trying. Shadow CDC. This is basically people out in the real world who are trying to save the deleted data and to get data from other sources. So, for example, if you want to know what's happening in maternal health, maybe you can get the data from the states, which is often how it gets to the CDC anyway, from the state public health department. Although some states have quit tracking data. Here's looking at you, Texas. States, for example, that made abortion illegal have seen an increase in pregnancy-related mortality. But how do you find that out if you don't have a database that tracks pregnancy outcomes? So that's been, a challenge to say, what is the impact of policy changes if you don't have the data at the data to find out what's going on? Now, it's back in 1996, the CDC was already told not to collect certain data on firearms. So firearm injuries were not tracked. They might show up in hospital-related CDC under the ICD-9 codes or ICD-10 now, but you weren't supposed to do research on firearms. And my colleague that I've worked with for some time, Dan and I both work with Garen Wintemute, and he has been able to continue doing research not funded by the feds, but funded by state and foundations, and his own salary as an emergency room doc. So this is the kind of impact is that research, it's not just that you can't say the numbers, you can't do the kind of research that depends on knowing the data. Here are some examples of ideology-based policy. So Jay Bhattacharya, who's now the NIH director, who is in principle qualified, except that he's an ideologue, says, oh, the focus now will be on reproducibility and rigor, transparency, and academic freedom. Except it turns out that the policy in NIH that prohibited political influence on government science was eliminated. And when people tried to interview the NIH spokesperson about this, that person had also been disappeared. The vaccine advisory panel, I think most of you probably heard about this. There was a panel of 17 experts who work with the CDC to set the recommendations for vaccines, for new vaccines and vaccines for infants and children and pregnant women and old people, and just to lay out all the general vaccine advice. They were all 17 fired and replaced with ideologues, vaccine skeptics, and that kind of got put a stop to, but it's not clear what's going on because the CDC guidance has now changed. And the American Academy of Pediatrics is very upset about this and has put out its own set of guidance. But the CDC guidance often has a lot to do with whether insurance will cover vaccines. So if you want say you're a pregnant person and you want to get vaccinated against hepatitis B because that was a recommendation, it might not be covered by your insurance because CDC doesn't recommend it anymore. So there's a lot of impact from that. If you want to get a COVID vaccine and you are not an old person, or maybe in some cases other people with pre-existing conditions, good luck. CDC guidance no longer recommends it for healthy adults, other than us geriatric people. They halted funding for vaccine studies, including studies underway. But they have funded alternative treatments for measles like cod liver oil, which has been shown to be ineffective, but it's now, under research. The CDC had a paper, the CDC inside, research people looked at their data and looked at data on hospitalization of, and so people come to a hospital and they get tested because they think they might have COVID. They have some respiratory thing. You go to a hospital and they, test you. And they were able to show using these data that people who had been vaccinated were about 50% less likely to have COVID when they went in to get tested. And it's pretty standard epidemiology methods, but Bhattacharya and the CDC people, ideologues, withheld publication. So the CDC people who wrote it are submitting it somewhere else outside CDC. But it's very frustrating. Acetaminophen in pregnancy is not linked to autism. There have been large studies showing it has nothing to do, not a risk factor, large studies that are very well, cohort studies in multiple countries. But RFK Jr. thinks it is. So he had advice posted that says not to use it if you're pregnant. It is the only appropriate medication to use for fever, or at least the most appropriate for fever if you get sick when you're pregnant. You should be taking acetaminophen. It has nothing to do with autism. And he also demanded that the CDC change its statement on the relationship of vaccines to autism and say some studies have shown that it's related, in spite of the fact that no valid studies have shown it is, and many large studies have shown it is not. But that's what they're doing. Here's some data that I thought, and I don't know if you can see this, but I'll tell you the categories. These are things that should be collected for people who are on, Medicaid. And these are supposed to be measures of how well states and administrators of Medicaid are delivering healthcare. They're supposed to collect data, and they have metrics. Oh, if you're delivering appropriate care through Medicaid. So the first one is the percentage of children age 2 who have had all 4 diphtheria, tetanus, and acellular pertussis, the 4 DTaP shots, who've had the 3 polio, 1 measles, mumps, rubella, 3 Haemophilus influenza type B, and 3 hepatitis B, and 1 chickenpox, the list of things you're supposed to have by your 2nd birthday. And the measure calculates a rate for each vaccine and the combination rates. So this is a metric of how well infants and young children are getting appropriate care. It is no longer being tracked. So Medicaid isn't tracking this. What that also means is that Medicaid isn't, if it isn't evaluated on it, it's one of those things that's going to get cut, that people just won't do. And they won't be recommending it necessarily. Immunizations for adolescents, another laundry list of shots for adolescents by age 13. That is no longer a metric for adequate delivery of healthcare. Poof, gone. Prenatal immunization for women under 21 and for women 21 and older. So babies are not born with a functioning immune system. So the way they get some immunity is through their mothers. In addition, if their mothers are immunized, they're not exposed during the birth process. But we no longer track whether pregnant women are getting appropriate medical care. And that reduces the coverage. Anyway, so it's not just, this didn't just start with Kennedy, okay? This didn't just start with 2025. Here's an XKCD comic strip that goes back to December 2021. And person A says, see, it's good to get infected because it gives you immunity. Person B says, well, why would I want immunity? Person A says, well, to prevent you from getting, wait. So this is a plan that might sound appealing to people who know just a little bit about the immune system, but it doesn't appeal to people who either know a lot or are ignorant. So anyway, this goes back, and you can actually see, if you look at the share of kindergartners who are vaccinated against measles, it started going down around the time of the pandemic. Part of that because it might have been hard to get to a doctor and get vaccinated, but part of it because of skepticism. Measles, polio, whooping cough, all down. We are now seeing cases of measles, a few of polio, it's not yet. And we're seeing cases of whooping cough, which is pretty horrible. Babies get it. What happens with measles? Here's an actual picture of what's going on with measles. In 2024, there were 263, I think it is, 83, sorry, cases total in the whole year. 2025, that was up 10 times, almost 10 times as high by the end of the year. And look how fast those cases are coming up now in 2026. Measles is a really bad thing. Some of us may have had it as kids. I remember having it and being pretty sick, but it's worse than just that. It has a lot of risks of things like encephalitis. And even if you don't have all the bad consequences, some people actually die. It wipes out immunity to other diseases. This is a recent discovery in the immune system that measles infection, not the vaccine, but the actual disease, can wipe out other acquired immunity for, until you rebuild it. And it's very, very contagious. If you're unvaccinated or immunocompromised and you're in a room with someone with measles for an hour or two, the chances are about 92% that you will get measles. But our buddies in the currently running things don't actually either believe that or want policy based on that. The FDA has been affected too. They have this new thing that for every new FDA regulation, you're supposed to remove 10. Who decides which 10? The industries being regulated get to suggest which ones are overly burdened. So the foxes get to decide about the hen house controls. The food industry, for example, no longer has to prove health claims. So they can offer some one of Kennedy's idiotic things that he proposes and say, oh, this will prevent something, prevent heart disease. Doesn't have to be proven. The fast track vouchers, there's a reason for these. They allow approval of drugs in 1 to 2 months, and they have been used sparingly, but now they are trying to have this so that many more drugs are approved even before clinical trials are completed. There are not a lot of FDA experts left, but they're only allowed to do limited review now, just one little component of FDA for fast track vouchers. And in order to figure out what to change here, Kennedy has ongoing an FDA listening tour to find out what recommendations people out in the wider world, except it's only pharma that is on the listening tour. Here's an example of what happens when you have non-experts doing this. He told the FDA to change the label on a drug called leucovorin that is used for cancer treatments to say it can treat autism. There are no clinical trials. There is no evidence that leucovorin has anything to do in the scientific background or justification is completely lacking. The FDA was also told to remove the blanket authorization for COVID-19 vaccines because they have their own process as well as the CDC, and to limit the availability for certain demographics because they get to determine something about what the availability is. Medicaid cuts. 10 million people are going to lose healthcare coverage, including 1 in 5 American children, 20% of children. It is already leading to closures of rural hospitals, some critical care hospitals, because it gets too expensive to cover people who don't have insurance. So that's going to shift the cost of medical care to people who do have insurance via their insurance. And so some people are going to go to less adequate coverage under insurance. And of course, if you don't have insurance and aren't getting preventive care, that increases chronic diseases and deaths. Now we come back to our international world. The president's plan for fighting AIDS, the PEPFAR funding was cut. That was already an estimated 158,000 adult deaths and 16,000. This is in 16 months. 1,000 added deaths per month of children. That has also led to 164,000 child deaths from pneumonia, 125,000 from diarrhea. Most of this is in Africa, but not entirely. More adult deaths from malaria and from TB, and this is from cutting USAID and PEPFAR. Now we come back to that headline about Ebola. Ebola has now spread from Congo, where it started, the eastern area of the Congo, to Uganda. There are cases suspected in Kenya, but it's been apparently spreading undetected for weeks or months. There is no vaccine. There is no treatment for this particular variety of Ebola. WHO has already declared it a health emergency. If you may recall, a few slides back, we said that the US was critical in dealing with the outbreak in 2014 in Western Africa. But we've left the WHO. The world-class Ebola lab in Frederick, Maryland, where we have the NIH has its infectious disease research, was closed. The lab would normally be in action. It was closed, and all the staff were laid off. Okie dokie. Health centers, medical supplies, cut back. So this is a really bad situation in Africa, but Ebola is something that's pretty easy to spread through direct contact with blood, and it can be spread before people are actually really, really sick. So here's an interesting comment. The World Cup team from the Congo is still planning to come to the US for the World Cup championships. Okay, in conclusion, I just say that Trump and Kennedy and Musk and Vaught have been a total disaster for NIH, CDC, FDA, World Health, everything. It could take decades to recover, even if we manage to get a Democratic Congress and elect some president who's committed to fixing the mess. But I will also say there are folks inside NIH who are fighting back. The NIH person, you know, a bunch of NIH people, insiders, and some people who'd been fired, posted a letter early on in the 2025 cuts and trashing about how bad this was and how bad it was going to be. Some people signed their names, people who are fearless. The person I work with most closely in NIAID, or one of the people, is a pretty senior woman who signed her name. And she's still there. I was just on a call with her a couple of weeks ago. She's very smart. She's very senior. They haven't managed to trash her yet. And I've talked with people in NIAID, one of the people who's retired but was very close to Tony Fauci, and um, they're fighting back. They're doing what they can. There's still good news. There's still good research going on. There's still exciting things happening. It hasn't completely shut down NIH, CDC, FDA. It's really hurt it, but it's not dead. It's ongoing, and so I want in the next couple of weeks, and I'm going to stop here, but in the next couple of weeks, I want to, or a couple of lectures, talks, whatever. I want to give you the good news. Immunology is kind of the real cutting edge on a lot of treatment stuff. And since we're all worried about our brains wiping out, it's not inevitable. Okay, there's some references, and I can share all of this. And I'm going to stop sharing screen and see if people have comments. I'm sorry, I kind of rattled on. We didn't have much to say. Were you all sitting there stunned and saying, "Oh my God, oh my God"?
I
Someone
have a question. I have a question, Laurel.
Yeah,
So early in the presentation, you said that the NIH cuts that Trump wanted did not get implemented, the 44%.
yeah,
So you said NIH funding was relatively flat, but
yes,
then there were all these other programs that have been discontinued and so forth.
yes.
That's outside of NIH.
That's
Is that
so
why?
USAID was an independent agency, and it got moved into the State Department, and it's basically gone for all practical purposes. PEPFAR was in that world, and it was cut, slashed, gone. WHO membership was terminated, and it's a separate thing. Yeah. So NIH funding, the funding level has been the same, but within NIH, a lot of that has been moved around. So all these grants being cut and people being fired, the 25%. So it's not exactly clear. They've tried to rehire some people. So it's not clear what's happening long run.
Yeah.
I had my hand up. I'm going to say why I
Okay.
had my hand up. My daughter works for the Packard Foundation, and most of her work is international.
Yeah.
So they were very, very involved with NIH clients. And, the immediate thought when this happened was that they'll see if they can find additional funding so some of these programs can continue in these third world countries. And the
Yes.
people who were with NIH were told, no, you cannot stay out of there. We don't care who wants to fund you, get out and go home. And they had to do that or they would lose their jobs.
Yep. Yeah. Yeah. That's that I've heard that from a number of places and on our grant reviews, I've been on study sections since this, and we can review a grant favorably and say this is important, it's really good, but we know some of them just won't get funded because the higher levels decide what's going to get funded. So the decisions are way political at this point, and even if NIH scientists think that some research is important and should be done, if the powers that be don't want it, good luck with that.
Is there no pushback from Congress? And is there no ability of Congress to push back?
There is some pushback. When Kennedy testified in Congress recently, he got scathingly questioned by Democrats and had no real answers. But so I think there are a number of people. The real question for me is, will people like Cassidy, who now has lost his primary, Cassidy, uh, I mean, he's going straight to hell for his. He was the one who interviewed a doctor, senator from Louisiana. He was a doctor who interviewed Kennedy, recognized that Kennedy probably was lying about his vaccine policies, and voted to confirm him to try. One assumes to try to make up for his vote to impeach Trump, and he lost anyway. And you have to wonder if Cassidy, who was asked if he regretted that vote and weaseled on an answer, you have to wonder if maybe Cassidy and a few of these other people who are going to be out, maybe they will get together and try to do something concrete. But Congress pushed back to the extent of refusing to do a 44% cut, but they left intact Kennedy's ability for him and for his henchmen to divert money from areas that they consider, woke or they don't believe. So yeah, there's a little pushback, but right now it isn't changing what's happening other than the total dollars.
It'll be convenient if there's an Ebola breakout in the United States because it'll play into the Trump narrative of the infectious nature of being black.
I don't know. I mean, unless it affected the oligarchs and the people in the White House and Kennedy, I don't know it would have any impact at all. They seem to be perfectly content watching 600,000 people, which is the total estimate of people who've died in Africa. And I don't know that they're that much concerned about people dying in the US unless it directly affects them. I'm sorry to be so cynical about them,
Oh
but
no,
they're
it's
blithering
fully
about
justified.
Christianity.
There's no reason not to be cynical. Cynical is not even, that's too flattering a word.
Laurel, it occurs to me that one of the challenges here, a couple of them. One of them is that that there's such a low level of science uh, knowledge in the general public, and these are difficult and complicated issues to communicate to the public. So I think that's one challenge. But the other one is that the Maha movement has a tremendous amount of popular support. And I think that's been one of the reasons that Kennedy has gotten away with these horrible policy changes at all of the health agencies, is because, he Maha, they've put their finger on some things that are problems and challenge areas, but their solutions are all non-scientifically based. But it's very difficult to counter this. I mean, would you have some ideas about how we can fight this science denial and this really ridiculous direction in the policy?
The science denial and science ignorance is really you've put your finger on something very important. But the other thing is that what he's actually doing, essentially none of it would comport with what we know scientifically about making America healthy. So the most obvious thing that's improved public health over the last 100 years is vaccination. And if you want, for example, to improve nutrition, you don't cut funding for school health programs. You don't cut funding for feeding kids in school. You don't cut SNAP funding. I mean, maybe you say, okay, well, we won't let people buy soft drinks. That's with SNAP money. Oh, all right. But it's very hard for me to point to any policies that actually comport with the idea of improving public health. But I don't know. I don't know um, how we manage to convey to people that, say, for example, reducing standards, eliminating standards on what can be in your drinking water, that somehow comports with Maha. I don't know how we communicate it.
I think, when I think back about the environmental challenges and the difficulty communicating those issues, and I think about, the Al Gore film and so on. I mean, it seems like there's an opportunity for uh, a really powerful documentary or series of documentaries that really get at this stuff and show people in very concrete ways the damage that's being done here. Because it seems to me that it's just catastrophic, but yet it doesn't seem to be getting the attention it should get in the mainstream media and in the public.
Yeah, and there are people on this call who are much more knowledgeable about what it would take to get such a documentary. People who've like worked with Disney. and people who've done documentaries. So I think it would be amazing if we could get an Al Gore like um, non nonfiction, a sort of real world statement about how could we really make people get people to be healthier, and why this isn't what's happening. The that super size me, the whatever it was, the Michael Moore thing where the going around showing eating at McDonald's, and there ought to be some way to have a little humor and a little scary stuff.
We need
And
a
I
few
see what happens
oligarchs to
to
come
Ebola.
down with Ebola. I think that will move the needle a little bit
Well,
and
given people are
die.
scared about hantavirus, which isn't really a threat.
Well, I'm gonna, after this meeting, go off and be a froggy for a while. That's just about the best I can do. I don't know what else to do. I've given money, I've written letters, and if you got any suggestions on what I, as just a simple, ordinary citizen, can do, I'd be very open to them, Laurel.
I think that would be a wonderful salon topic for, um, as we move forward to have something about what can we do. So I have a neighbor here who is her background is in civil engineering, water. I mean, she has science background. She's not an ignorant unto, but she thinks that Kennedy coming in is terrific, and she thinks
What?
she's a Maha person, and I have not been able to confront her and say, here's what's happening. How are you down with this with your science background? But I probably at some point, I mean, she's become kind of a friend, and I don't know. I don't know whether it's worth trying to say, gee, I've noticed there are a few things happening that worry me. You as a scientist, I know you were hoping Kennedy would do some cool things. What do you think about this part of it?
Yeah, I think that all the shocking numbers of people who've died abroad are really not relevant to the MAGAs because they don't think those people have any value as humans, and we shouldn't be involved in those countries anyway. So I think for those people, all of a sudden a bunch of right wing folks start getting Ebola, that would change their perspective on things.
Well, don't they realize that that none of these infestations have a knowledge of international borders? Aren't they just? Isn't that kind of clear from?
Oh, I think what that does is feed into their conspiracy theory ideas, as it did with the China pandemic, and I think they already think Africa is, I quote, shithole countries, a place of shithole countries, and the idea that would just, I think, convince them, get rid of all the people from Africa, and let them sit there and die. We don't care. They're
Really, it's to our advantage if they die.
Well, we're starting to talk about new contracts with African nations to deport American citizens that Trump doesn't like, and so they can die too.
yeah. The Ebola is starting to spread. They think it's going into Sudan, which is one of the countries, and Uganda also, one of the countries they're talking about deporting people to.
Laurel, I noticed when the most recent conversations about vaccines, the anti-vaxxers has come up, that they point to is it Denmark, one of the European countries that does a lot fewer, many fewer immunizations at very young. I think that the number of of shots that are given to very young infants is a concern. And I think that kind of fueled the anti-vaxxer thing, as well as I think COVID. I think COVID, the response to COVID, a lot of people felt was, overdone in terms of shutting down schools and so on and so forth. And then, of course, the argument that the COVID vaccines were approved too quickly without the proper amount of scientific rigor. I mean, all these things just have fed into the Maha conspiracy theories. And it's
Yeah.
really it's a much, I think it's a much larger and more potent group than we really believe.
Yeah, I think that's true. And there's been a lot of conversation in the public health community about the failures of communication during the pandemic. And I think people were doing the best they could based on what they knew, which was limited early on. But I think that did feed in. And as you say, people don't know much about um, how a vaccine gets developed, tested, approved. One of the reasons it was able to be done so fast was that the AIDS epidemic, the setting that Fauci set up this big network of um, academic medical centers with the labs that had the ability to do the testing of immune function and things that really you could really do a fast turnaround. And part of that was what Fauci set up then, plus the setup for the H5N1 in 2000, or sorry, in 2009, that had a very rapid turnaround and kind of set up a system for how you respond to a pandemic. So it happened so fast thing that was approved. It went through the testing. I read the clinical trials, all the clinical trial reports, and I didn't see anything in there that suggested there were that they cut corners. It's just that they already had the infrastructure to roll out, and they already had the mRNA vaccines in development. And it was just a matter of changing the little add-on the top to say, okay, deliver something that works for COVID. It's much faster than the mRNA vaccine. The whole idea is that the delivery system is very clever and can be switched to a different thing really fast. So I don't know. I don't, and science instruction, I think most teachers don't know much about it. So
That's why ideas like, herd immunity can take hold so easily because people they want to believe that stuff. And, again, the numbers, even I think even before Kennedy got into his position, there was problems with some of the data coming from some of the states. I mean, Florida was claiming that they did as well as states that had immunized more thoroughly with COVID. And I just don't think the information has been presented to the public in a really effective way consistently. Um,
so this is an area where you obviously have given a lot of thought to how do you do education both early on to get people somewhat familiar with science, and how do you make a structure that does outreach. What would you do if suppose you wanted to um, convey information about, say, vaccines and how they work and why it's a good idea, like the little XKCD cartoon, why it's better to get immunity from a vaccine rather than getting sick. How would you?
when you mentioned Michael Moore, I mean, I think you're on the right track. I mean, he's an example of someone who's been very effective at taking on subjects. In fact, one of his films was about the health system and health insurance. Um, I think we need some powerful media people to get behind this and really put the information out there in forms that people can understand and relate to because it seems to be just it seems to have a real strong foothold. And I think Kennedy, I mean, the one of the reasons I think that Trump put Kennedy on his cabinet because he realized that MAHA group could be an important constituency to him getting reelected. And it's going to be difficult to push back on that because this is really populism at its worst.
I wish Stephen Colbert would get, but of course we think of him as a really funny, wonderful guy, but I think the Maha people might not react. So we need the face of this has to be someone who can reach.
Maybe we can get Ken Burns to do a documentary on this. He's also a very effective communicator of complicated information.
Yeah,
But
but people won't watch those things. They'll just be dismissed by Fox News and And the president has left-wing woke propaganda, and nobody will watch it that needs to watch it.
Well, an inconvenient truth was seen by a lot of people.
And
Of course,
dismissed by a lot of people.
well, I get it. I get it. Well, the other question I had, Laurel, is to what extent is private industry moving into some of these areas that the government is abandoning?
Yeah.
That's a really good question. And I think I have not seen much of that. Private industry actually has had partnerships through NIH. They have the Foundation for NIH. So our Alzheimer's disease neuroimaging initiative gets funding from NIH that's actually from industry but piped through the Foundation for NIH. And and that's partly, I guess, to insulate us from direct pressure from industry regarding results. So I have not seen as much of that. I have seen some of the nonprofits stepping up and trying. So the Michael J. Fox Parkinson's, the Alzheimer's Association, the American Academy of Pediatrics is or whatever it is, Pediatrics Association. I think it's the American Academy of Pediatrics. They have been stepping up to convey information and help doctors couch their recommendations, to sort of give doctors wording and training. And sometimes that helps. So the AMA, for example, has brought to the attention of general practice people the issues of gun safety, firearm safety, and so I don't know how many of you, when you went to the doctor, had someone ask you if you had a gun in the home.
Yeah.
Never.
Yes.
No.
So I mean, it's happened to me.
Really?
And
You
so
have
because
I think
that's
it's
a risk
mandatory in New York.
So is there, and there's also questions, especially if you're women, doctors will ask you if you feel safe at home. Did you get asked that? Yeah. Yeah.
But I got to run, but I just want to say thank you so much for this, and thank you everybody for the great conversation you're having about it. It's wonderful.
Well, I really appreciate it. Brian, did you have your hand up? I thought I saw your hand.
No, I've been asked whether I felt safe at home,
Oh, you have been.
Oh,
and I'm not sure if I've been asked about guns. It's possible.
I've been
Yeah.
asked if I'm depressed, and
Yeah,
I
all the
say no.
depression
And
screening.
I say, they say, well, you should be. Uh, but uh, but I've never been asked about a gun. Laurel, geez, this is about all I could take of this. I mean, I really didn't want to listen to it, and my worst fears have been justified. Um, so I'm sorry I had to listen to this, but I know I do. Uh, can we
I'm
look
sorry.
forward to slightly more pleasant information next time?
Yeah, next
I'll be
time
here
will be
anyway.
fun.
I'll be here anyway. Don't get me wrong.
No, next time will be fun because immunology is so cool. And when Brian and Gerald and I were in the NIH world and taking classes, and some of you may also have had classes in biology and whatnot at Pomona, we got this like little introduction to immunology. And when I started actually working in the field in doing immunomodulator trials with HIV, I had so much catching up to do because the whole field had so expanded, and so I'm not an immunologist, and I feel a little like talking about what I know, but I had an immunologist when I gave a talk on this to the biostatistics graduate group and statistics graduate students. There was actually an immunology person there who said I did okay, and I didn't say anything really wrong yet. So that'll be fun next time. Immunology is like crazy. It's just weird. All this crap that's running around in your body starting when you're born, and that you have no idea what's going on there. It just runs itself. It's so cool.
Okay, well, regrettably, let's call it a day today, and we'll
Thank you.
continue
Thank you
next
all for
time.
being there.
Well, thank you so
Thank you,
much,
Laurel.
Laurel, for
Thank
that.
you.
Well, it was great.
We're lucky to
It was
have
really,
you.
really interesting. Thank you so much.
Well, thank you. Well, I hope Tuesday will be more fun. We'll see you then.
Okay.
Right.